most famous physical therapist on the internet.
Hi, folks. I'm Bob Shaw, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to talk about what is causing your knee pain. Is it patellofemoral pain syndrome or kneecap pain? How to tell. We're going to show you some tests you can actually do.
Right. One way or another, it's knee pain.
Right. So patellofemoral pain, patella is the kneecap, by the way, and femoral is the bone right here underneath the kneecap, at least half of it anyway.
Part of the femur, the big bone above.
So patellofemoral pain syndrome is an umbrella term or garbage term, as they might say.
Garbage term. Wow.
Yeah, have you ever heard that before?
Well, yeah. I didn't realize it was applied to this particular name.
It's for any pain that arises around your kneecap.
Mm-hmm.
So it could be a lot of things, but we're going to tell you generally what it is.
Sure.
It's generally felt in the front of the knee, around the kneecap. It's more common in people who participate in sports and running, obviously. So kneecap pain can be caused by trauma. I mean, you could get a blow right to the knee itself.
Yep.
You could fall on it,
Sure.
or someone could take a baseball to your knees, baseball bat. But the more common reason why you're having pain there.
What kind of sports do you play, Bob? I'm sorry.
So the more common reason for the knee pain is actually there's a little groove here. Oh, you're going to show on this one, Brad. It shows better.
So here's the kneecap. This represents the tendon because the kneecap, the patella is actually part of the tendon from your quadriceps to where it connects below here. But if I flip this over so you can see the patella.
The kneecap, yeah.
And then here's the
groove.
Yep, the groove, the condyles I call it. It's the end of the femur. And those, they're kind of a red or pinkish marks I put on there. That's where the contact, like this contacts here and this contacts here. And this patella slides up and down as you flex and straighten your knee. And if everything's going right mechanically, the kneecap should fit right in that groove and, be nice and smooth. But there can be problems where the kneecap shifts one way or the other, or you could have some arthritic problems, some degeneration of the cartilage. And as it slides up and down there, it's rough and it's painful. And that's where I think Bob was saying, you got that garbage can term. Is it from arthritic problems? Is it a mechanical misalignment or from a trauma, getting a baseball bat?
Or is it because your hips are not lined right?
Sure.
Let's say your hip is lined up so it kind of pulls you out like this. Now the kneecap's going to want to ride more inside.
Right.
Same with if you have flat feet. You're going to maybe go like this, and now it's going to ride more on the outside.
Right. So the slang term is, are you bow-legged or knock-kneed? Yeah, those little things can cause this kind of problem.
Right. So, the key is we're going to actually, when we do testing, is we're going to see how it fits in that groove and how it feels when you are in that groove.
Right.
So now the common signs of patellofemoral pain are a lot of times when you sit for a prolonged period of time with the knee bent, because that kneecap is really up against that joint then
There's
for a long time.
There's a little more pressure on those tender spots.
So if you sit with the knee bent more than 90 degrees, here's a right angle. But if you're like that.
Like mine right now.
You sit that way for a couple hours and it starts to hurt.
Yep.
Doesn't mean that it's this, but it's starting to point the finger to it. If you have like tight jeans on and it's really pushing against the kneecap
on that,
and that hurts, those skinny jeans, I think they come out now with the mom jeans again. I can't keep up on it. The fashions.
I don't even know what clothes I wear. So.
Yeah. So pain going into or coming out of a squat, which makes sense because that puts more pressure on the kneecap. Going upstairs or hills.
Sometimes I've had a number of people where up and down stairs hurts, but oftentimes it's like going down is a little more painful than going up.
Yeah.
But we won't get into that.
When you're wearing high heels, Brad.
Well, I quit doing that a long time ago.
Or if you stand with your knees hyperextended. So I used to stand like this. See my knees go way back like this? I don't know if you can see it on this one or not.
You could take your pants off and show, but
I've kind of lost it.
We're not gonna.
It's not as bad as I used to be. So
sure.
That can throw off the kneecap and the joint
too.
So here are the three tests. If you are have loose ligaments or are double jointed, I want you to be careful on this. You maybe want to skip this test.
Sure.
Because I don't want you to push this. We're going to move this kneecap around in the joint. Yeah.
Kind of like.
Yeah, like that. Up and down.
Yep.
And quite often, in somebody who's having trouble with this, it often is tight. It may be tight one side to one direction,
Yep.
or it might be tight globally, which means in all directions.
Yep. There's
And-
do you got plica syndrome in there? You know, that's a
Yeah.
common one where it's tight one direction particularly.
Yeah. So, Brad, why don't you show on your knee? And,
Yeah. So if your quadriceps are tight like that, this won't work. You have to completely relax these quadriceps, and then you can see that kneecap. A healthy kneecap will move right to left quite a bit, actually, and it should not be painful. You know, if you do that and you push down, you want me to talk about something? And you put some pressure on there and you go back and forth, and that's painful. That's not normal. And then you can go, like, here's my kneecap. I'm going to go up and down and check it that way as well. That should be pain-free, even if you put pressure on it. You know, you can do some diagonals on there as well. There's a tissue called plica, which is support on this side. If that plica gets tight, or we have some tight tissues here, it can pull the kneecap one side chronically, and then you get a malalignment on the patellofemoral surfaces, which can be part of the problem. There's a surgery called lateral release, where they go in there and they'll cut that plica so it allows the kneecap to go where it wants. But you know, there's a number of things you can try before that.
I would say most commonly it is tight on this side. So when you push the kneecap to the middle,
this way,
it's tighter.
Sure.
And you want to compare knee to knee.
Right.
And you may find if you have a painful knee versus a non-painful knee, although sometimes you have it in both knees.
Yeah.
This one doesn't stretch as well.
Yeah.
And look at the big kneecaps I have, Brad. These are big ones.
Yeah, the hyper kneecap. Whoa.
My wife says I have dinosaur knees. So
wait till you get older.
So, and Brad mentioned the kind of the number two. You can also push down on the kneecap and grind it back and forth. And you want to feel, are you feeling pain? Are you hearing noises, crunchy noises? That may be a sign of patellofemoral. That's quite often what I would see, Brad. In people.
Do you have the test where you palpate underneath?
Yeah, I'm not having them do that one because it's a little difficult to do.
A little more advanced, right?
Yeah. And the final one is you just squat down until your levels are thigh. Your levels are thigh. Your thigh level. Thighs are level.
Yep.
I'll get it yet.
Parallel to the floor, something.
And increased knee pain could be a sign. Well, of course, that can cause increased knee pain for everything. But it wouldn't feel good with patellofemoral pain. So quite often, very common. I had a daughter who had it in both knees, so it's not
at the same time.
Yeah, it's not unusual, especially if you're, the knees are the same. But if you have flat feet, that could cause the knees to go in, and it could cause the patella to be farther out.
Yep.
Next video will show you some of the treatments you could try for this. So stick around and check it out.
I'm excited about it because I was just about to talk about treatments, but now we're not going to. We're going to have to get on the next one.
Yeah, there you go.